Friends, good evening. I'm Dr. Ashutosh Gupta. And so, in a day, almost whenever we are doing this level 2 or an anomaly scan, we usually try to take the couple, the lady lying on the couch, and then the expectant father behind, take them along, and to really make them understand how the things are moving to the baby and all the stuff. So, the whole idea is to really look around to the baby and to make them see and understand what is the whole structure of the baby is all about, how the heart and then the nose, nasal bone, upper lower jaw, fingers and toes and all those stuff, and then how the baby is lying and what the baby is doing. Right. This is usually the scenario whenever we are doing the ultrasound, and whenever it is feasible, whenever it is subjective, and whenever it is feasible, so probably we make them see how the baby would look like into a 4D and all the stuff, right? So we really came across with one a playful banter in which the patient was an old patient of mine, and they had come with a twin pregnancy, and this was at 19 weeks and 5 days. So I was just talking about them, about what all that probably we would wish to see in an anomaly scan, and they were not worried about any of that particular sort. They were more concerned about the nose. They were only concerned that this is all your job to see how the kidneys and the heart and the fingers, and then they are there. We are not here to see. We are just here to see what is the. So there was a playful sort of a banter between the husband and the wife regarding the tip of the nose, right? So how did the nose of both the babies look like? So this was their pertinent question. So let us go through these sort of in videos and slides, and then we'll talk. So this is what we are doing at 19 weeks and 5 days. This is 2 and 2. So the tip of the nose looks. This is T1. So this looks slightly sharper as compared to the twin 2, which is slightly bulbous. Right now the baby is extended and stargazing, so we would not be. So this looks slightly bulbous, but then this is could be an artifactual stargazing. And this is the tip 2 in 1, so sharp nose. So we can identify the tip of the nose is slightly sharper. Probably we would have a better images as we move on further. And this is T2. This is 2 and 2, right? This is 2 and 2. This is 2 and 1. So 2 and 1 looks more sharper. The tip looks more sharper, and the facial profile looks. So this is a bulbous nose slightly, but right. And then you can see the difference between the T2 and the T1. T2 looks slightly bulbous, and the T1 is. So this is how the T2 looks like, right? And this is the T1, so it's slightly sharper as a matter of fact, right? So probably we try to capture all these things in a video also, and then probably I'll try to make you see. So this is T2, right? So slight amount of an sort of an bulbous nose, and this is more sharper. This is 2 in 1. Many a times we are really caught in this playful banter between the couple, and they were very sweet and nice, and they were just enjoying the baby, and therefore there was sort of an um, uh, this is some sort of banter was there between both the parents, between the tip of the nose, right? And but in a 4D we see that almost in 19 weeks, 5 days and 20 weeks they would look almost the same, but all this difference between being slightly bulbous in the tip of the nose is just the cartilage of that nose, and then probably this could be very variable between both the babies across, because then we are dealing with the DADC twin. This could be genetic different, might be different in different sort of an genetic makeup and all those stuff, right? But this is how probably we enjoy seeing the babies. The fetal ultrasounds are absolutely fantastic. They are almost endless. So keep on looking around for the baby and just keep on enjoying how the baby does the different phonetic things across, right? Thank you very much for your patience.